Hi there, and welcome to Her Season of Strength, where women over 40 reclaim their bodies, their energy, and their voices without apologies. I'm Kim Duffy, registered dietitian, personal trainer, mom, and your biggest hype woman when it comes to aging like you mean it. This show isn't about chasing skinny or counting wrinkles. It's about building real strength, physical, emotional, and hormonal. Each week, I'll share straight-talking nutrition tips, sustainable fitness strategies, and conversations that help you feel powerful in your skin once again. Menopause isn't an ending, it's only the beginning. This is your season of strength. Hello and welcome back to Her Season of Strength. I'm so happy you're here and thank you for taking just a few minutes out of your busy days to tune in. As you're listening when this drops on September 11th, a little personal update. I will be in Huntsville meeting my very first grandson. To say I'm excited does not even begin to express how I feel about becoming a grandma for the first time. And in just a few days on September 15th, the 5-day Midlife Momentum Challenge kicks off. This is the free combined exercise and nutrition coaching program where you get 5 days of workouts on your own personalized phone app. You can do them whenever and wherever is most convenient for you. This challenge is the perfect reset for women over 50 to get consistent with quality nutrition and strength training for free. I'll drop the link in the show notes. So today I want to chat about a class of medications that are on fire right now and making headlines under names like Ozempic, Wegovy, and Rybelsus. Before we go further, let me be clear, I am not a doctor, and nothing in this podcast is medical advice. I am not recommending or prescribing medications to you. My goal is to give you clear, researched-back information in a way that makes sense to you so that you can have more informed conversations with your own healthcare provider. If you're wondering whether a GLP-1 is right for you, please reach out to your primary care provider or another qualified medical professional to discuss. So how do these medications actually work? Let's start with the basics. So think of your blood sugar like the temperature in your house. 2 hormones act like the thermostat. One is insulin, which is the air conditioner that cools things down when your blood sugar runs high after a meal. And glucagon is that furnace that kicks in when sugar dips too low, keeping you from crashing. Together, these 2 hormones keep the system balanced. Now, here's where GLP-1 and GIP come in. After you eat, these gut hormones, which are naturally made in your body, are like the traffic cops that show up at the busiest of the intersections. GLP-1 slows things down so that food leaves your stomach more gradually, you feel fuller longer, and it signals the thermostat to cool things off by helping insulin work better, while also turning down glucagon so that your liver isn't pushing out extra sugar that you do not need. So GIP is that other hormone, and it is short for glucose-dependent insulinotropic polypeptide. Ooh! Say that 5 times really fast. It's that partner officer down the street. On his own, he is not as powerful for appetite, but he helps to signal insulin to do its job even better and smooths out fat metabolism. So when we combine GLP-1 and GIP, they work together like in the newer dual medications like tirzepatide, sold as Mounjaro for type 2 diabetes and Zepbound for weight management. They're basically coordinating traffic flow and keeping that thermostat steady. The result, it's less food noise, more stable blood sugar, and often bigger weight loss results. As a dietitian and trainer with over 30 years of experience, I want to give you the whole picture, the benefits, the risks, what we don't know yet about long-term use, and how to protect your muscle and metabolism while you're taking these medications. So let's dive in. First of all, how do these medications work? First of all, they're said to turn down the food noise. This has gotten a lot of controversy out there, but they act in your brain to reduce appetite and cravings and to cue those fullness signals. They affect your blood sugar in that they increase insulin when your blood sugar is high. They decrease the glucagon, like we were talking about, which slows that stomach emptying and causes steadier energy and less grazing and snacking. Tirzepatide adds that second signal in there called the GIP that can actually amplify your weight and your A1C decrease or changes. All right. So what does research show when it comes to the benefits of these medications? Weight loss averages on semaglutide, 2.4 milligrams, they're actually showing a double-digit percentage body weight decrease in 68 weeks. And that was a study from the New England Journal of Medicine. Now, tirzepatide, that's that one that has both of those hormones in it. They say that the studies have shown about a 20% weight loss at 72 weeks. Now, that's, it's a significant amount of time, right? In obese patients without diabetes. Okay, and sometimes the head-to-head shows larger losses than semaglutide in some studies. Next, when it comes to heart protection, Wegovy can lower major cardiovascular events like heart attacks in people with established cardiovascular disease and overweight or obesity. And it's actually FDA approved for that cardiovascular indication. And then lastly, we see metabolic improvements. Obviously, we see a lower A1C, so hemoglobin A1C, and if you didn't listen to last week's episode on blood sugar and hormones, you can go back to that, and I can put the link in the show notes. But your hemoglobin A1C just tells us what are your blood sugars doing over the previous 3 months. And especially after menopause or postmenopause, we can see that A1C going up. So, and we know that, as it goes up, it makes us at higher risk of type 2 diabetes. So we do see that it lowers hemoglobin A1C, and we also see a decrease in visceral fat. And what that means is that's that fat that surrounds our organs. And when we do have more fat around our organs, we are going to see that we are at higher risk of diabetes, of cardiovascular disease, of just chronic illness in general, as well as cancers. So we talked about benefits. What are some of the risks and cautions? Well, sometimes, I would say frequently we do see gastrointestinal effects like nausea, vomiting, diarrhea. But we find that when the doses are ramped up slowly, that can make a difference. That can decrease some of those GI side effects. But regardless, we are going to feel those. Why? Because it is slowing digestion. It is holding things in your stomach for longer, and sometimes, especially, depending on how much you eat, it can make you feel nauseous if things are just sitting there. And sometimes you can vomit. So next, some of the risks are if you have any gallbladder type disease. That risk is higher with these medications, especially at those higher doses, and especially after we've used it for longer periods of time. And especially when we're using it more for those weight loss specific indications versus diabetes. So one thing you can do is, watch for any kind of right upper quadrant pain. So right under that right rib. If you're having a lot of pain there, that can indicate that something's going on with your gallbladder. But like I said, that would be definitely something you'd want to be talking to your doctor about or going and getting checked out. Next, in diabetic retinopathy, so that's just a complication that can occur with diabetes, and that can affect your eyesight. And we do see that that can be affected with that rapid improvement in your blood sugars. And like I said, that was in the New England Journal of Medicine, so it's something that you definitely want to talk to your doctor about if you have any kind of diabetic retinopathy. Next, it can slow down the emptying from your stomach and could cause something called gastroparesis, which is when you have chronic slow emptying from your stomach, which makes you chronically feel kind of full and nauseous. Next is pancreatitis. Data's mixed on this, but we do find that overall risk signal is low, but it's clinically important. So if you have a history of pancreatitis, or if you're having a lot of abdominal pain, you're going to want to definitely seek care for that, because that is not a comfortable inflammation of the pancreas. It can cause a lot of pain. Okay. Next is thyroid cancers. You're going to want to make sure to talk to your doctor about it if you have any kind of personal or family history of any types of thyroid cancers. because they do see an increase with that. And then if you're having surgery, there is some guidance around that. And most patients can continue to take their GLP-1s around surgery, but a lot of times you need to talk to your doctor about this, because since it is slowing what is leaving your stomach, a lot of times they'll have you not eat after midnight, maybe the night before. Well, if you're on a GLP-1, they might have you hold the GLP-1 a week before, or if you are continuing to take it, they might have you take like more of a clear liquid diet for a day or two beforehand, because they don't want anything sitting in your stomach, because that can increase risk of, like heaven forbid you throw up or you aspirate after surgery. We want to make sure that to keep you safe if you're having any kind of surgery. So definitely talk to your doctor if you have any planned surgeries scheduled to see what you should be doing if you are taking the GLP-1s. So now let's talk just a second about two different types of GLP-1s, compounded ones versus FDA approved. And these are very important because we know that, the Food and Drug Association, when they're approving medications, they undergo rigorous safety and quality checks. So compounded versions are cheaper because they are not FDA approved for safety and efficacy. So you want to make sure to talk to your doctors about that and see, how important it is for you if you should be taking, more of the FDA approved versus the compounded formula. The FDA has flagged dosing errors and fraudulent kind of research only, in quotations, products. It was kind of like out of, there was so many shortages on some of the brand name products, and that's where the compounded products came about, because they could get them faster, but they have found that there might be some issues there. So the bottom line is, using the FDA approved brands from legitimate pharmacies. Be wary of the generic semaglutide or tirzepatide claims, and just make sure that you're getting your medications from reputable sources and that you are being followed by a doctor. So the next problem, and that I worry a little bit about as a dietitian, is the then what problem. So when we stop these medications, frequently weight comes back on without those strong habit systems in place. So they have done some research and shown that many people who have gotten off these medications, about 2/3 of them regained the weight that they had lost within a year off the drug. And that's concerning to me. That's similar to me as, like yo-yo dieting. When we go on these diets that we're losing the weight very quickly, unfortunately, we can lose muscle with that. And so after all is said and done, we lose the weight quickly. Then maybe we go back to what we were doing before. We regain that weight plus a little bit more, and we're not burning as many calories as we are. So it's going to be a lot easier for us to gain weight, and it's going to be a lot harder for us to lose that weight. So what's really important when it comes to being on these medications is have a plan in place before you start tapering. And that's going to include your nutrition, your resistance training, getting good sleep, managing high stress, and having a solid support system to help you hold that line. So these are habits that we want to start working on immediately when we start on this medication and before we start losing that weight, because we really want to focus on muscle first and protecting that metabolism while we're on the GLP-1s. So we are going to plan, if you are losing, and if you have a larger weight to lose, you're going to lose muscle. I mean, that's just part of weight loss is if you're have a lot of weight to lose, and if you are losing it faster, we are going to lose some muscle. And that muscle is what burns calories, right? And so that is going to affect metabolism. So a greater amount of it is going to be fat, but muscle is so important for metabolism as well as longevity, right? As our goal is to age well, right? So we want to make sure that we are maintaining as much as muscle as we can, because we know that we naturally are going to lose it as we get older. So what is going to preserve that muscle best while you are losing weight? Well, it's going to be progressive strength training. So you've heard me talk about this so many times, but making sure that we're challenging those muscles. And sometimes People on these medications, they don't feel like working out, especially if you're losing weight quickly. It can make you more tired. You can feel a little sick or nauseous. People can have headaches. It makes you not want to be exercising, but it's all the more important for you to be doing something, moving your body, trying to get in some resistance training, and making sure you're getting in good protein to help to maintain that muscle. And that means more than 1 to 1.2 grams per kilogram per day. That's a starting target for many adults. And then also just making sure that you're finding ways just to move more. So getting outside, going for walks, doing yard work, dancing. I don't know, whatever is your favorite type of movement, but just trying to move more, because exercise is going to blunt that lean mass loss. Okay, it's going to slow down the lean mass loss and really help you to focus on the fat loss. So a practical place to start is trying to get in maybe 2 to 3 days a week of strength training. Even if you're starting with maybe 15 to 30 minutes each. It doesn't have to be a 60 or 90 minute workout, and it doesn't have to be 5 or 6 days a week. If you can start with 2, that's fantastic. Okay, plus trying to just get in the daily walks, the daily steps, and making sure that you're anchoring protein at every meal. So where's my protein coming from, and then build your meal around that. So who would be, who might consider GLP-1s? Well, first of all, if you're considered obese or overweight, now granted, I don't like BMI numbers, but, especially if you have complications. So, if you are a type 2 diabetic and, you need to get down your A1C, if you have cardiovascular disease with overweight and obesity, if you have other issues that, that cause you need to, decrease your A1C, or you need to decrease your weight because of, high cholesterol, high blood pressure, those kind of different risk factors. It might be something that you can chat with your doctor about to see if it would be a good option for you. So who should avoid or seek specialty input from their doctor when it comes to getting on these kind of medications? Well, definitely someone that has any kind of thyroid cancer, either personally or in their family. If you have active gallbladder or pancreatitis history. If you have significant diabetic retinopathy, we talked about that was, the eyesight complications from diabetes. And obviously if pregnancy, or even with infertility, or if you're, working to get pregnant, GLP-1s. I guess that's definitely a conversation to have with your doctor. Sometimes, if improving your A1C and losing weight to make it easier for you to get pregnant or to carry a baby, that might be definitely a conversation you want to have with your doctor. So just kind of circling back around, we know that these medications, they can quiet the food noise. They can kind of unlock and give you that push forward, that momentum, right? But it's so important for us to build those habits. When you do have that momentum, when you are feeling good, when you are seeing weight loss, making sure that you're really focusing on what is my plan for when I do start weaning from these medications, or if I do plan on, now, if you're a type 2 diabetic, if this is something that you're going to be on for the rest of your life, it can be, these medications can be thought of as kind of chronic illness. Some people look at it that way, and some doctors look at it that way. And so they might recommend that, you stay on this medication, some form of it, for the rest of your life. But other people that are on it to lose 20, 40, 60 pounds, you might reach that your goal weight and, no longer want to spend the money on this drug. And so wanting to go off of it, building those habits are just absolutely important, right? We need to make sure you're getting in enough protein. We need to make sure that you're doing resistance training to build up and maintain that muscle. Finding ways to just move more during the day. And then also taking care of your body, making sure that you are, like I said, getting in that sleep, managing those stress levels. All of this comes together in creating that lifestyle to maintain that healthy weight. So how will I be doing that next week while I am going to be in Huntsville, hopefully snuggling a newborn little baby? I'm going to hope to get in some short lifts. I'm going to bring my workout bands, but still on a bit of a weight restriction since my surgery, even though I am bouncing back wonderfully. I get to go see the doctor here in a couple of days for my 4-week follow-up, and hopefully she's going to tell me that I can start lifting again. That would be amazing, but got a lovely little Airbnb there, so hopefully we'll be able to make some of my own meals and maybe do some cooking for my son and his wife so that they have some meals in the freezer to eat on while the baby is, they're getting used to their new lives with that little one. So don't forget that the Midlife Momentum 5-day free challenge starts here in just a few days on Monday, September 15th. If you are looking for ways to build up those good habits or looking for ways to kind of reset here this fall, this is going to be your perfect chance. I will put the link in the show notes. And of course, always, if you enjoyed this podcast, if you thought it was beneficial, I would love a rating or a review to help other women to find the show. And share this episode with a friend who might be curious about GLP-1s, or maybe they've been thinking about some and want to get some of their questions answered before they head off to their doctor. Message me your questions or your thoughts on food noise, because this is definitely a controversial topic. There are people that have never had food noise, that have no idea what it is, and other people who have struggled with it and they know exactly what you're talking about. So remember, this is all about progress over perfection. We're in this for the long haul, and this is your season of strength. Have an amazing day.